Hi, welcome all today to Launch and Learn. Very excited that you're here to listen to our presentation and also to learn a lot more about the child well-being team and how we could make an impact. And together we have a panelist, which is Roger, Molly, and Simone, and we're all going to be going through the presentation. And one of the reasons with regards to the child well-being impact team, you might ask, like, what is our overall goal? Definitely, our goal is to ensure that all children within the states are supported, they're safe, and then they're also thriving. So the vision of the child well-being is to ensure that all children are safe, supported, and thriving. And also our goal as a team is to increase the health and well-being of all Arizona kids. And also during the discussion, if you have questions, please feel free to include them in the chat. We also have a time towards the end to go back and open for discussion, and we'll answer all questions. So thank you all once again. And then I also see some familiar names in the chat, Mo, Ashley, and everyone else. Thanks for joining the discussion today. And as our team, I'm Joycelyn. I'm the leader, and I was also part of the class 41, the last and best class ever. And I'm sure others would agree with that. We also have Molly Patterson, and Molly she also went through the Ready Together class with Roger. So they both went through that class together. And we have Simone, and we're glad you're part of our team. And she just finished the Catalyzed class too. So thank you all for being part of the presentation. And now I'll hand it over to Molly. Thank you.
Hi, I get the benefit of starting us off today. So I am the Director of Strategic Partnerships with Prevent Child Abuse Arizona, which is a statewide nonprofit dedicated to strengthening families and protecting children through education, collaboration, and advocacy. And in my role, I get to learn all things child well-being and primarily the upstream approach. So you may have heard of this if you've attended a presentation through our organization before. Claire Luge, our executive director, often speaks to Valley leadership classes, but there's the terminology of upstream prevention and downstream prevention. Downstream is what most people are pretty familiar with. It's what we can picture if a child's in trouble. Typically we'll ask people, what is child abuse prevention? And they'll say, oh, it's making a phone call or reporting abuse if we think it's occurring. And that's actually intervention. It's intervening when a problem is already happening. Whereas upstream is trying to look at, well, what's contributing to putting children in danger or contributing to stress on families. And that's what our organization does. And that's really the concept of child well-being, when we focus on ensuring that all children universally are getting the care and resources that they need. We are successfully ensuring child well-being and prosperity for our communities. So I'd like to talk about child well-being in Arizona. Here are a few statistics that just really paint the picture of what's happening in Arizona and underline the importance of child well-being and not just child welfare. So about over 70% of Arizona child abuse reports are related to neglect. And the hard thing about neglect is it's really tough to differentiate neglect from poverty. Now, poverty isn't a problem. Isn't a problem as far as families intentionally or unintentionally trying to provide resources. It's a challenge that parents face. And so when an investigator comes to their home and there isn't enough food or there isn't electricity, is that neglect? It's something that we're looking at in a data approach, but we want to be able to ensure that all families have the resources that they need. And in doing so, all families and children benefit and we see reduced neglect. So 44% of calls do not meet the criteria for an investigation. And what that shows us is that there's an over-reliance on the Department of Child Safety, hoping that they will connect families to resources. And plainly, that's just not the case. We have an investigation only response through our Department of Child Safety. And so when there's a concern for a family, they're met with scrutiny and suspicion, a safety assessment. And while sometimes they can be connected to what they need, it's just not efficient or effective. And it often leaves families feeling like asking for help is going to make them at risk of being exposed to the Department of Child Safety or losing their kids. So this data just paints the picture that families are struggling with accessing resources. We use the metaphor that just like a truck that's overloaded beyond its capacity, parents can feel overloaded by stress. And when they feel that weight, it makes parenting, which is already a demanding feat, like overwhelming. And when parents are overwhelmed, they're less likely to respond with empathy and self-regulation for their children. And when you add in heavy stressors like poverty, racism, and more, there can be way too much overload to ideally care for their children. And so child well-being is actually all about parent well-being. And the research is there to support that the more we focus on parental well-being, children benefit. So how do we reduce that overload on parents? We can do that in multiple ways. We use the Valley Leadership's 3-tiered approach, which is systems, community, and individual. So today we're going to explore those modalities for you to make systems change in your unique community. For example, I'm located in Prescott, Arizona, Yavapai County, and those needs may look very different to those in Maricopa. And then finally, individual, what you can do individually to learn, grow, and support child well-being within your own sphere. It might be your family, or it might be somewhere where you can volunteer. I geek out about systems change. My role at Prevent Child Abuse Arizona lends itself to systems change, but also since becoming a parent last year, I have an 8-month-old, I've seen the importance of having the infrastructure that supports families. And systems change achieves the maximum amount of benefits for the most families. And we need to advocate for policies, both at the state level and the federal level, to support families. And so we have these 3 approaches, and I'm just going to run through some of my personal experience with it. I've been advocating on behalf of families for about 5 years now, but I've only been a parent for 8 months. And that personal experience has really honed in what it's like to navigate being a parent in our nation and lacking some of that system support. So strengthening economic supports for families, what does that look like? It can be paid parental leave. My organization provides 12 weeks of paid parental leave. And what that did for me is I was able to focus on bonding with my son without worrying about the financial stress of managing that time, losing an income as a 2-income household. And organizations can do that all over. Unfortunately, at the federal level, we don't have any mandates to provide that, which is actually pretty common in other first world nations. So speaking of working, we have maternal paternity leave, but then there's getting back into the workforce. And I've experienced firsthand the struggle in finding quality early child care and early childhood education. And so I was on a wait list of 80 families here in Prescott for infant child care. And now that I'm still talking to families who have been on that wait list for years, and they don't know how to sustain their income and get back to work with having a safe place for their families to go. And so that's another federal policy of how can we increase accessibility, affordability, and quality of childcare. Right now, my child care agency is going through a couple of discussions about teacher to child ratios because the tuition that we pay doesn't cover costs, but they have to meet this middle ground where tuition did cover costs, families couldn't afford it. And so where is that extra funding coming to supplement it? There's also a study that there's about $27 billion loss in gross GDP because parents can't access affordable quality childcare. And then finally, teaching skills, and that's teaching skills to be a parent. There is no handbook. And so I received early home visiting which meant that a professional entered my home in the prenatal and postnatal time. Prenatal, they supported my mental health. I was experiencing some very normal mental health challenges. So I was actually referred by my OBGYN as a way to receive support beyond what my OB can provide me. And then postnatally, they looked at my son to make sure he was meeting the normal developmental milestones. But above all, they were there to support me and to give me suggestions on how I could bond with my son, but also empowering me as a parent to step into those shoes when it feels so overwhelming. They were a voice that didn't have any shame and really unlocked that ability within myself. And that's the gold standard of prevention. And so those are all captured in the CDC's recommendations. So you can see on the top 3 tier, family-friendly work policies go so far in helping families have economic support, which enables them to provide resources for their kids, ensuring a strong start. You can see early childhood home visitation and early quality childcare. Those are game changers. There's so much evidence to suggest that those make a difference for families. And currently, we just don't have the support in our nation that we need. And so it's all about us, you, me, all of us using that evidence to communicate to our lawmakers that it's important, both at the state level. So there's state supplementation for quality childcare, but also at the federal level, what can we use with those federal tax dollars to support families? And that just benefits us in folds. Now, you heard me say tax dollars. So everything costs money. And we have an expensive nation. There's so many costs that are demanding, but we also have evidence to suggest that it can save money in the long term. So other wealthy first world countries spend an average of $14,000 on the first 3 years of a child's life. In comparison, the United States spends $500, and that discrepancy is mostly seen in the provision of parental leave after work. Some nations will do 6 months to a year, which is honestly ideal for that developmental time frame, and then also childcare. So one of the parents on the wait list at my childcare center is from Russia, and she's been waiting and waiting and is so stressed about going back to work because where will her child go, even though she really needs that income. And in her very strong accent, it's like, this isn't a problem in Russia. What's happening? So that's a huge discrepancy. And the Department of Child Safety uses 61% of Arizona's welfare spending compared to 8% national average, meaning those welfare dollars that include food stamps, SNAP benefits, what we now call them, and other welfare support like childcare subsidies are going towards our child protection system, which is downstream. Intervention is really costly. And so with that last bullet point, when we balance prevention and intervention, we can really reduce overall spending. And that's what we need to do in these systems policies. So that is a summary of a really big concept, but really just showing that when we look at our state and federal systems, we can achieve that maximum benefit for all families. And now I'll transition to the community option, which narrows our scope just a little bit.
Thanks, Molly. Hi, everyone. I'm Simone. I also work for Prevent Child Abuse Arizona as the training manager. I'm a recent Catalyze grad for Valley Leadership, and I just joined the Impact Maker team for child well-being. There are lots of ways to help with child well-being in the community. Today, we're focusing specifically on a couple of programs that hone in on foster care because children who have spent time in the foster care system are significantly higher risk for a range of problems. So we'll talk a little bit about becoming a CASA volunteer, which is a statewide program. Roger will talk a bit about that. And then we'll talk a little more about mentoring a foster youth or getting involved in a different capacity if you're not able to dedicate that amount of time. So I will pass it off to Roger to talk a little more about CASA, and then I will catch us up towards the end.
Thank you, Simone. And I'm so glad that you're here and part of our child well-being team. My name is Roger Lurie. I completed the Ready Together program through Valley Leadership during COVID and joined the child well-being team. My career was actually spent in information technology management for Arizona State University. So this is outside of my professional career, but really found a niche for me to serve as a CASA. And that's what I'm here to talk to you about. What is CASA? CASA stands for Court Appointed Special Advocates. And I just want to break down that definition, or I just want to break down the definition of a CASA. First off, it's a court-appointed role. It's run through the court system in the counties within Arizona. It's also a nationwide program, so that I believe it's been implemented in every state in the United States. As court-appointed, as a CASA, and by the way, this is a volunteer role, I have access to educational records and medical records, and able to talk to Department of Child Safety and advocate to all those parties, in addition to a judge that is representing that child through the juvenile court system. What does a CASA do in a typical day? They get to know the child, spend time, quality time with that child, and really develop a bond and a relationship with them. They gather information, reaching out to therapists and schools, educators, attorneys, and so forth, to make sure that really there's 360 degrees support for that child. They collaborate with Department of Child Safety and all of the other professionals involved. They mentor the child. In my particular role, I tend to work with children, young adults, I want to say, teenagers that are nearing the point of aging out, and helping them figure out a path towards higher education and learning how to do finances and many of the things that we take for granted growing up with parents. And then, of course, the advocacy role, that really the heart of it is making sure that child's needs are being addressed. So who are these children in foster care? They're really anywhere from age 0 up to 18. In my particular case, I was working with a young man who just turned 18. And even though my official CASA relationship with him ended, he has asked that we stay in contact. And he's mentioned to me that I am the only really caring adult in his life, and I continue to mentor him. There are children that have been removed from their houses due to abuse, physical abuse, verbal abuse, or just neglect. Some are living with relatives in what we call a kinship placement, some in a foster home, but many, particularly the teenagers I've dealt with, are in group homes. What do those group homes look like? They're often 8 to 10 boys or girls crammed into like a 3-bedroom house with really hourly employees that are coming in and out, to make sure that the kids have meals and are following house rules. There's really no loving relationship there, if you will, between those group home employees and the kids, but they have all experienced trauma to some extent. And they really just want to be kids and have a normal kid or children life like many of us have had. Next slide, please. In Maricopa County alone, roughly about 8,000 kids in foster care. And right now we have less than 1,000 CASAs. And typically most of the CASAs will just take on one case that could be a single child or it could be siblings. Some of the CASAs do sometimes take on a couple cases at once. So you can imagine the number of children that are in foster care that don't have that kind of mentorship and advocacy that we can provide through being volunteer CASAs. Next slide, please. CASAs really come from all walks of life. As I mentioned early on, my professional life was in information technology management. I really had no experience coming into this, the psychological impact on child well-being, the legal background needed to learn this role. And I just have to say that the training as I onboarded to become a CASA was really incredible. I mean, I got exposed to the court system and what the attorneys do, what Department of Child Safety does, what my role as a CASA was. Some individuals will co-CASA. They share a case and collaborate with perhaps a sibling or another volunteer. I think the important thing about becoming a CASA is really a passion and a desire to help children and help children succeed through their childhood. Next slide, please. There have been studies that have shown that children that have a CASA generally perform better in school, stay in school longer, hopefully avoiding young adult homelessness, or in some cases with girls sex trafficked. They typically have fewer placements, more services, and some of the services I've been able to provide through my kiddos, like the young man that I'm mentoring right now was able to get a grant to be able to do driver's education and get his driver's license. I'm not sure how that would have possibly happened without the mentorship involved. Services are targeted and received sooner, and they're less likely to be reunified with a parent and re-enter the foster care system. Next slide. To become a CASA volunteer, I think the most important thing is the application, which is maricopacasa.org. That, of course, is specific to Maricopa County. The requirement is that you are 21 years of age or older and either a U.S. citizen or a permanent resident. As part of the onboarding process, you do have to provide references, personal statement, go through an interview, and then you get to the onboarding, which was 30 hours of training, which I have to say was really outstanding. I believe I am now handing it back to Simone.
Thanks, Roger. Molly, we can go to the next slide. CASA is fabulous. I love CASA. I am a CASA. I've been a CASA for 6 years, and I know a big goal of this Impact Maker team has been to recruit more CASAs, but it is a big commitment, and there are other opportunities if CASA does not feel like a good fit. So there is a mentor program. This is specific to Maricopa County too, but I'm sure there's mentor programs statewide. Mentors offer a different opportunity to support children in care. You can bring your kiddos home, you can spend time with your extended family, you can take them to activities, introduce them to people you know. CASA has some pretty stringent rules about not involving them in your personal life. And so there is benefit to being a mentor to a foster child as well. And if that's also too big of a commitment, we can go to the next slide, Molly. There is another program that is statewide, Arizona Friends of Foster Care Foundation, and they are always looking for support. They're a fabulous organization. They offer funding for tons of things for children in care, ranging from tutoring to extracurricular activities, paying for yearbooks, paying for prom dresses, and supplementing experiences that kids in care can lose the opportunity to have due to being in foster care. They also have a program called Keys to Success that supports children that are transitioning from foster care to adulthood, and you can partner with that program and employ a foster youth as a partner organization, become a preferred partner for any sort of service that's offered to these foster kiddos, or just donate. And they are a tax deductible organization, so you will get that back at the end of the year because they are a foster care organization that is supported by the state. And I'm going to pass it back to Molly now, I think, right, Molly?
All right, thanks, Roger and Simone. So for our next level, we're looking at the individual level, which is cool because all the other modalities take time. So for systems change, it's a lot of advocacy, pushing a bill through, knowing the legislative process. And then as a CASA, it takes time to get there. Roger mentioned the training curriculum. There's also like an onboarding process. And so hopefully you listen to these individual tools and know that you can implement them today while still working towards the system and community goals that we shared. And so it's all about learning more, sharing and influencing your circle. So by now you may feel that prevention is a massive undertaking, but there are many ways that you may already be preventing child abuse and maybe might not be seeing it that way. So after this, you'll get a sheet from Paige in a follow-up email, and it provides some recommendations of where you can continue learning about the problem. I gave just a couple of statistics that focus on Arizona, but there's a lot more to it. And so there's phenomenal podcasts. That screenshot is really good about understanding neglect and that contradiction between neglect and poverty and how to differentiate the two. There's also some really wonderful books. And talk to those with lived experience. So understand how it shows up in your community and the unique challenges that face parents in your community. Being a CASA is a great way to do that. And then explore how you can make a difference. And that goes back to the system and community areas that we just discussed. And I'm going to tell you a little bit more about the third bullet point, which is Lean on Me AZ. So Lean on Me AZ is an effort to raise awareness about the factors that protect families from overwhelming stress, the kind of stress that can cause parents to lose hope and become overwhelmed, which is that overload than the truck metaphor we talked about earlier. So Lean on Me is also focused on providing tools to identify and strengthen what already happens in communities that supports families and builds on those community strengths. So systems change is about changing what happens in communities. There might be lacking there, but Lean on Me AZ is all about simple strategies that are already existing and how can we increase that support. So the document includes 26 tips and strategies to support families. The neat thing is that these tools were co-created via statewide focus groups in nearly all counties to tap into knowledge of what is already happening. In the system section, you may feel overwhelmed by all that needs to change, and this is meant to encourage you to start today, start tomorrow, but just start increasing child well-being in your area. And the goal is really to move from that culture of surveillance, which I described in the investigation response with DCS. So many families feel surveilled in their communities, and that decreases their initiative to ask for help because they see it as a weakness. But when we can shift that to a culture of support, families are more likely to ask for help and receive help, which is essential to child well-being. So throughout this, I'm going to share stories and then a coordinating tip. And these stories and tips all came out of those co-created those focus groups, which co-created those tools in Lean on Me AZ. This is one of my favorite stories because a version of this was highlighted in almost every focus group. And there were both sides of the spectrum, really positive experience like this one, and some negative experiences too. So once an older couple walked up to me while my 4-year-old son was melting down and said, "You're doing great." I felt so supported. I was walking on air. And this was years down the road. If you're a parent, you may feel that like little bit of anticipation of going in public because you can't really control how your kids respond, especially when they're going through these developmental times that result in tantrums and meltdowns. And so a lot of parents felt the opposite, where they felt shame or negative comments about their child's behavior, and that also had a lasting impact on them. So the takeaway from this is to really be a parent ally. Make sure that you're making comments like this. I think we could walk out in public a couple times a week and guarantee at least once you'll see a parent struggling with their kiddos, and their kiddos are being rambunctious. And so you could say something positive like, "Wow, your child is strong-willed. That's really going to benefit them someday." Some tips are to know your neighbors. That's how we can provide support, just knowing them and exchanging numbers, then you'll have it when you need it. I am like a Gen Z millennial right on the cusp. And so I don't really like to talk to my neighbors, but my neighbors have been awesome at introducing themselves and really modeling for me what neighborhood support looks like. Explore all options. So when you have a concern, ask yourself if you can resource it or have a conversation with the parent to offer support. So that statistic that 44% of reports don't warrant an investigation, a lot more efficient option would be to talk to the family and see what's going on and connect them to resources. So those mandatory reporters can actually be mandatory supporters and help the parent in a more authentic fashion. Hey, share. So that was the second tier of this. You can be a resource to friends and family. Share help proactively and specifically. Being more specific about the help we can offer makes it more likely that that's going to stand out in a parent's brain when they reach a crisis or a challenging time. Of course, be mindful of offering help when it's asked and respecting boundaries there. Another really helpful way is to be a search engine. We all have access to the internet, and I'm sure you felt overwhelmed by identifying resources or identifying strategies. And so the more that we can research that for families, it's there when they need it. Here's another story. When I became a teacher, I realized that some teachers judge parents a lot. I'm a mother of a special needs child, and when I heard other teachers making judgments on things like dirty shirts, I wondered what teachers had said about my child and my parenting. Instead of judging, we should be asking ourselves how you can help. Personally, I remember myself having a little bit of judgment before I became a parent, and now I know all of the nuances and influences that go into that. And so this is a mental shift we can all work on, asking for help and having that supportive nature instead of judging. Judgment is just so pervasive in our culture and in our parenting. And as Brene Brown says, shame and guilt are not very productive emotions. So how can we reduce that influence on families? Speaking of influence, we can make a positive influence just by modeling behavior for others to adopt. So educate rather than denigrate. It's really important for us to be mindful of how our opinions and offering help is perceived by families. My home visitor did a wonderful job modeling it for me so that I can model it for others. Sometimes when I asked her for help, she would say, well, what is your initial thought? What would you say the solution is? And it really built confidence in me to become a parent and step into those shoes. And it showed that she trusted me. And so the next time that she offered support, I knew that we were both trusting each other and figuring it out together. Watch your language. How we talk about others asking for help or judging others really impacts everyone in our sphere. And so when you catch yourself talking negatively about people receiving government assistance or other forms of concrete help, change those social norms to normalize help seeking. Things like we all need help sometimes, or sharing experiences where you really needed help and reached out. That's really important. Normalizing stress among all parents is a way to decrease stigma. And then convene and show up. We're not parenting in isolation, although it can often feel like that coming out of a pandemic. And so it's so important to convene families, to show up for families, and just provide opportunities to build those social connections, which is a protective factor against abuse. This is one of my favorite stories on influencing. So one day, my friend and I were walking to a playground with her child. There was a mother with a fussy 2-year-old. The mother was clearly frustrated and she started spanking her child. My friend didn't miss a beat. She walked over in a non-aggressive way and said, yeah, I remember when mine was that age. Do you mind if we can play so you can take a break? The other mother accepted, and it completely changed the energy of the situation. It was really powerful. And so she started by normalizing the situation, that what the mother was experiencing was developmentally appropriate and something that we all experience. And we can all experience that frustration. And so how can we respond in a calm fashion? and know that calm creates calm. It's really important for parents to be regulated emotionally for their children so that they may regulate them. But when we as parents are unregulated, we need somebody to look for who can help calm us. And that just benefits everyone. Okay, so how will you take action? You heard systems, community, and individual recommendations on how to make a difference in child's well-being in our state, in our community, and within your families. And so we will send you a PDF that synthesizes a lot of this information and actionable steps. And then you decide how you can take action. Is it a CASA? Is it some of the other strategies that Simone recommended? And get specific. Even in the individual tools that are very applicable today, choose a few that you're going to work on. Setting a goal. Next time I go to the grocery store and I see an overwhelmed parent, I'm going to mention a positive comment. That specificity really makes it more actionable, and we are all driven to do as members of the Valley Leadership community. So I'm going to pass it back to Joycelyn or Paige.
Yes, okay, so thank you all. And then I'm going through the notes in the comments session, and then also Paige and Amanda, also thank you for being here. So I'd like to open the floor at this point before we go through the comments. I want to say thanks to Maurice also for your comments that you made earlier, and then kind of going through to make sure we didn't miss anything. Okay, thanks for the link. And then Paige, if you want to open the floor, so if anyone has questions, please definitely feel free. Thank you so much, Molly. Thanks, Simone. Thanks, Roger. Thanks, Paige. Thanks, Amanda, for your time and also going through the presentation. I deeply appreciate all your hard work and efforts putting it together. Okay.
All right, well, if there are no questions, we will be sending out the recording as well as a one-pager that has a list of resources and other ways that you can get involved. I will also CC all the presenters from today. So if you want to follow up with any of them directly, you can do that as well. So thank you everyone for joining today. Any last question? Oh, Maurice.
I was going to say, Roger, how has it been post-pandemic as a CASA? Trying to normalize things with youngsters?
It's a really good question. It's certainly difficult during the heart of COVID to maintain contact with the children. I think at least my observation has been, other than a gap in education, in many respects, I feel like it's much like it was pre-COVID, except that so many things that we used to have to do in person, such as child family team meetings and foster care review board and court hearings, we're now able to do by Zoom, which is convenient. Of course, we want to see the children in person, which we're back to. And yeah, during COVID, I had to get very creative to really keep the kids engaged on Zoom or on the phone or that sort of thing.
Molly. Mm-hmm.
I'm just curious, Maurice, you were really contributing in the chat, and you seem familiar with a lot of the resources that we shared. And I also see some familiar faces in the child wellbeing space. And so based off of your expertise of those I see and anyone else, what did we miss? Is there any other way that we can really impact child wellbeing that you think deserves to be highlighted in this short presentation?
I'll just add it. I'm Dr. Christy Jackson. I was part of the Ready Together group. I'm the State Teacher of the Year, and I support a lot of educators. And so I'm always looking for ways that we can help build extended networks with roles like CASA and mentors, because I know teachers also, especially when you have a student that has experienced a trauma or is placed in foster care, we try to follow those students and make sure that they're taken care of, and the next year's teachers know that. And so I'm always just advocating for any time, like Roger, I would love to know if you were supporting one of my students, to know that they have that connection and know that you're that consistent person that might reach out. So I don't know, I know that there's a lot of, information and protection of people's information around anytime we're introducing someone into a child's life, but any connections that are possible to be made to those children's teachers, or even their social workers or their counselors at their school, I would love to advocate for that. And so if we could provide information, or you asked about what might be left out, how in those roles they're able to connect, or that would be amazing.
I can speak for myself that I feel like it's very important for me as a CASA to reach out to teachers and make sure they understand what that child is going through, what their home environment is like, and develop an open line of communication with them. One reflection point, I had a teenager. I had at one point siblings, and the girl was in high school, the boy was in middle school, and I took the girl to a parent-teacher conference. And on the way there, she said, I have never been to a parent-teacher conference before. No one ever cared enough to take me. And the next thing out of her mouth was, not that I really want to go, but, I have now become a peer coordinator for other CASAs. And I think advocating to them that they reach out and get to know the teachers as well. There was somebody on named Ashley Dickerson, who is now part of the child well-being team. Ashley works for an organization called Foster Ed, which I think does a lot of liaison work between the foster children and the schools. So thank you for your comments, Christy.
No, thank you for that very much, Roger. I appreciate it.
And thank you, Christy, too. We'll definitely follow up that with, we have the group we meet with. I know Roger meets with the Maricopa County team and also with Voices. So see how we could pass that information over. Yes. Yeah, you're on mute though, so I can't hear you, Christy. Yes.
I'm just happily agreeing with you. Thank you so much.
Are you welcome? And Simone, you want to add anything in? I see you trying to talk, Simone.
No, I'm sorry. I'm at a conference and I'm talking above the computer.
Okay, that works. Sounds good. Okay, good.
I was more curious about just this group in general. Like, do you have to go through Value Leadership to be a part of this, or what is this with the child well-being impact makers?
Yeah, I can jump in. So the Impact Maker is one of our secondary programs once people have gone through either Catalyze or are an alumni of one of our other programs. So Catalyze is our foundational program, and then we have a number of different teams. So I think right now we have 10 teams that are working on different initiatives across the state. And so our child wellbeing team is one of those. And this is sort of the production of one of our great volunteers' work and time and investment in addressing this issue.
And just to join in, I'm not sure if the period has closed, the Catalyze application. I know that came up, so that might be also an opportunity. So if you haven't gone through VL, definitely look through. It is a great organization to become a part of.
Awesome. Well, thank you everyone for joining today. We'll send the follow-up information, and yeah, absolutely reach out to any of the presenters or to Amanda, myself, if you have any questions on any of the team's work or how to get involved.
Thank you all, and enjoy the rest of your day.